security, we have all the human resource, but our main challenge is infrastructure. This hospital was built as a health center.
Yes.
It was upgraded by word of mouth to a hospital. No structures were added. Yet we are expected to give an output equivalent to that of a standard district hospital. We are surrounded by facilities like Rara Hospital, which was built way back, but as a standard hospital. You go to Hohoi Municipal Hospital, it's a big structure. You go to Nkwanta, they have 2 robust standard district hospital. You cross the river, you go to Karachi, they have another nice hospital. However, ours is the structure of a health center expected to deliver like a hospital, which is impossible. Management has done its best by trying to put up structures so that we can function effectively. But it is not possible. Even bigger hospitals like Buem and Komfo-Anokye, it is government that builds structures. These are very huge hospitals, but they are unable to put up structures. But we have been able to put up structures in order to contain, within reasonable limits, the number of clients. But we've reached our wit's end. We are unable to do that again, especially when the monies we are generating from NHI do not come in time. When they come due to the longer duration before we are reimbursed, the money would have depreciated. We have a lot of operational cost in running the hospital. So what we want to tell the concerned citizens is that appeal to the corridors of power, that the 88 hospitals that the government said was going to build, initially that was what the president said. But when he repeated it again at Koforidia, when he was cutting the sword for the construction of the Eastern Regional Hospital, the number had escalated to 109 or something, which means that people had lobbied. And instead of 88, additional hospitals are going to be built. So if we really want to hold the flag of Jasikan high with respect to the district hospital, we need infrastructure. This structure you are seeing right now, it's when it rains, it leaks. We have done a lot of repair works. You can see new painting. Last year we spent in excess of 25,000 in renovation, close to 30,000. Then we had to repaint the whole hospital. However, it is when it rains, it leaks again because the structure is old. And we learned that when it was built, it was left in the bush for a while before it was occupied and operationalized. And therefore, when a structure is left that way, you don't expect it to maintain its integrity as it should be in its original form. So, not to bore you, as I said, we need to appeal to those in power so that Jasikan can also get a standard hospital. We have enough land, 74 acres. 74 acres, both on the left and right side of. In fact, the road passes through our land. So we have enough land to contain any form of hospital, even if it's a teaching hospital. And this is what we will appeal. And because the structure is not standard, you are not getting the requisite human resource. A surgeon was sponsored and trained, but he didn't come back. Rightfully so, because when he comes, there is no space. When he operates, there is no surgical ward for the patients to go. We have a single theater, and therefore it is impossible for a specialist to come and work in the structure of a health center. And that is what we are appealing to you. Yes, we currently have a structure right in front of us, which is the emergency unit. This is from the IGF. The member of parliament for Buem also supported, but this is where we have got to. Other than that, when emergencies come during peak hours, there is no place to manage. And therefore, people agitate and claim in town that when they bring emergencies to the hospital, we are slow to react. But it's not possible to nurse a patient on the street because the OPD will be occupied, the consulting rooms are occupied, the wards are occupied. You can go to the maternity ward. I came to the hospital today at 5:30 to come and do rounds because the maternity ward was full to capacity and women were sitting on benches. We had to move them to our general ward. And by the general ward, what I mean is that the hospital has a single ward that contains male, female, and children instead of separate wards. And these pregnant women will also move there, which does not augur well for good clinical practice and ethics, because there is no privacy. You are not supposed to mingle pregnant women with other people. And this is what we are contending with. So we appeal to you that something urgently will have to be done. we are not indigents, but we have sworn and have taken pledge to work professionally, and therefore we are here. But others will not come because they think that the facility is not standard. They will prefer to go to other places where there are structures. Thank you.